Attention hospital HR in Canada. Are you in search of the perfect insurance solution for your part-time and casual employees? Look no further. Meet Healthcare Providers Group Insurance Plan, your go-to option for ensuring the well-being of your team.
With healthcare providers, also known as HCP, you're not just providing insurance, you're providing peace of mind. HCP's comprehensive coverage includes medical, dental, and vision benefits designed to keep your part-time employees happy and healthy. There's even a package that includes life, long-term disability, and accidental death, disease, and dismemberment coverage for those who already have other group health and dental coverage.
It's time to bridge the gap between full-time and part-time staff benefits. With Healthcare Providers Group Insurance Plan, you can level the playing field and show your commitment to all of your team members.
Join the community of over 145 hospital sites who have made the smart choice. Visit healthcareproviders.ca today to discover how HCP can help you support your team in a meaningful way.
Is this thing on?
I think they can hear us a bit better now. Do you think they are ready to change the status quo?
It's one thing to get them listening, but now let's get them to act.
You are now about to witness the strength of nursing knowledge.
Hi, and welcome to the Gritty Nurse Podcast, an unfiltered and unapologetic podcast which discusses health and healthcare. My name is Amy.
My name is Sarah.
And we are your hosts.
Don't forget to hit the subscribe button wherever you listen to podcasts: Google, Spotify, iTunes, or our YouTube page. Please rate and review us.
Make sure you get our book, The Wisdom of Nurses. There's no better gift than giving the wisdom of nurses to nurses during Nursing Week. Hey everyone, imagine this. Imagine you as a woman going to your doctor to deliver a baby, right? It should be pretty straightforward. You're going in, you're going to deliver your baby, you're going to return home in the 24 or 48 hour range. You most likely think that the only thing that you're going to take from the hospital is, maybe some bad attitude from labor delivery nurses. Haha, I'm just joking. But really the only thing that you should leave with is your baby and your family, your extra bags. Well, what if you left with a needle, an epidural needle that was left in your back that years later you ended up having pain, not knowing it was there. And then they found that that was the thing that you left with, the extra thing, that it was an epidural needle. I think that people would think that this is shocking, but it's actually something that has happened many times. And it's actually come out in a story recently with a CBC Go Public of a patient who had an epidural needle that was left in her back. So before we get into the details of the episode, I want to pass it over to Sarah to talk about that there is actually a video with this particular patient, and just to kind of talk about a little bit of high level of what happened to this patient.
Yeah, so we're going to run this clip right now so you can see exactly what it is that happened.
My pain is here to stay.
Giovanna Ippolito is living with a 4-centimeter long broken needle in her spine. The doctor responsible failed to tell her or noted in her medical records when it happened during the births of one of her 2 children. Instead, it was discovered during an X-ray more than a decade later. She's told scar tissue makes it too dangerous to remove.
Somebody made a mistake many years ago, but now they need to be accountable for it.
Even walking down the stairs is hard, as Go Public first told viewers almost 4 years ago. Around that time, Ippolito started trying to find out which of the 2 anesthesiologists involved in the births is responsible. Fast forward all these years later, both the hospital and the Ontario College of Physicians and Surgeons have been criticized for botching investigations into her case.
No due diligence. It just infuriates me.
The hospital was criticized by the province's patient ombudsman for unfairness and deficiencies in its patient complaint system. And the college was scolded by the Independent Health Professions Appeal and Review Board for failing to obtain the essential relevant information when it cleared both doctors in the case.
That includes neglecting to figure out what kind of needle it was, an epidural or spinal. Key information that may have identified the doctor responsible. Instead, they told Ippolito there's nothing they can do because the medical error wasn't noted in her records.
There's a real power imbalance in the sense of all the information about what happens to a patient is in the hands of potential defendants or in the hands of the medical professionals.
In March, that review board ordered the college to redo the investigations.
I do not want it to happen to anybody else, so I continue to fight.
So Ippolito waits again for the results of yet another investigation. Meanwhile, both the hospital and the college didn't answer Go Public's questions about Ippolito's complaints, citing privacy. Rosa Marcatelli, CBC News, Calgary.
This is actually a really, really shocking story. And as you see in the video, there's a woman by the name of Giovanna Ippolito who has been living with a broken needle in her back after it broke off during childbirth. And the worst part is an anesthesiologist left this 4 centimeter long. So for you guys in the US, that's like, what, 2 inches, a 2-inch long fragment embedded in her back and didn't tell her what happened. And so this is crazy. Like initially it was discovered during an x-ray more than a decade later. And the woman says that the doctor can't directly link the pain she's experiencing to the needle, but one thing has been made clear to her. It is not safe to remove it. This is the part that actually shocks me the most, because not only has she been going through this pain for so many years, but now she's literally being told it has to stay there because all this scar tissue has grown around the needle site and they can't remove it.
Yeah. Sorry, go ahead, Sarah.
No, and yeah, it's just too dangerous to remove. And like, I guess to add more insult to the injury, they're saying that they can't tell her what happened because apparently it wasn't in the record. So there's no record of anything being left in her body. But obviously this needle just didn't just show up. She had 2 kids and she's not sure, but during one of the childbirths, it was left in her body. And now she's left trying to figure out what to do next.
Yeah, this is absolutely infuriating. And I think anybody who's out there that will receive healthcare should really be thinking about how infuriating this actually is. And it's not just infuriating, it's actually very concerning, because at the end of the day, you know, you go to receive care or whatever, you're vulnerable. When you're seeking healthcare, you're in a vulnerable position. And to know that, you know, if some harm may befall you, that not only will they just not even tell you which one of the practitioners that it might have had caused this error to happen, that they will obfuscate, they won't tell you the truth, or they might have not even did anything. No investigation was even done in this lady's case, which is insane, right? Normally, what would happen is if they felt that there was, you know, harm or something that befell a patient, that they would do, you know, a quality improvement measure where they would bring all the people together. They'd say, hey, this happened. How do we prevent this from happening? But that step couldn't have even been taken, because the other piece of this that is super insidious is clearly one of those physicians must have known that they fucked up and left that needle in her. And they were just like, I ain't saying shit. Because if they had said something, that would have been the thing that would have triggered the whole, like, you know, quality improvement process. But clearly there was no investigation because somebody knew what exactly they did. They knew they fucked up. They did nothing. They said nothing. And to me, that is almost the most concerning part, because obviously that's, if you taproot it down, it was an individual who essentially did not disclose that there was harm and just left it, just said nothing.
Right. And it gets worse. So not only are they saying the doctor in question didn't know about the fragment, but hospital officials flatly refused to look at the x-ray showing the needle and made no effort to properly investigate her complaint. So, you know, she's left with this really bad situation. She's gone to the hospital. They're refusing to look at the x-ray. It's almost like they want to cover their eyes and be blind to all of this. So then she went to Ontario's patient ombudsman for help, and it found unfairness and deficiencies in the hospital's patient complaint process, but doesn't have the authority to enforce the hospital to take any action. So it's more of the same. Nobody's taking accountability for this poor woman and a number of other patients who have been in similar situations. Like, I've heard of all kinds of crazy things being left in patients. When I went to research this episode, I Googled instruments
no.
left in patients. And you know what came back? It was like sponges, scissors, forceps, like tweezers, like anything and everything under the sun.
Right.
And unfortunately, this isn't an isolated incident, but there's also some allegation of botched investigation. So the College of Physicians and Surgeons of Ontario neglected to get an independent expert to try and identify what kind of needle is in her spine when she filed complaints against both doctors involved in her births. And that's key information that might identify the doctor responsible.
Well, of course, that the CBSO is not going to get involved, and of course that we're never going to find this information. It's because there is no accountability, and of course, again, taprooting it back down to one of these two physicians. Clearly, it's one of the two of them. But again, I think this speaks to the culture of medicine and how they're like this. They're kind of like this in group where they have so much protection that it almost makes them impossible. Well, in some articles, in some senses, impossible to actually sue. A part of this was she did actually talk about, litigation. And there has also been another article that the CBC wrote about, like wanting to sue your doctor. Well, you're going to be up against a powerful group with billions of dollars. So literally the CMPA, so the Canadian Medical Protective Association, defends doctors with over $6 billion in assets funded in part by our tax-paying dollars, which is wild. So again, like, even if you get down to the point where you're like, I want to sue this person, they've wronged me. They didn't investigate. They didn't, do the right thing by disclosing that there was harm. They didn't, even now that we've found that there was harm, nobody's coming forward. Well, even if you got down to saying, okay, I want to sue them, the fact of the matter is litigation and actually winning a case is so far between. They make it such an arduous process that, these lawyers go scorched earth on patients and families, and they make it a really difficult go. And I think that, again, is a problem. That speaks to the fact that whose interests are at heart here? Is it the interest of the patient or the interest of the pocket, the person who has more money and more power that can, essentially squash this little person at the end, saying, you know what, too bad, so sad, we got money here. And for those people who are suffering, they get nothing. It speaks of, again, a huge power imbalance, which is very, very problematic.
Right. And I just think about the re-traumatization of this poor woman who's gone through so much already. And I feel like this is what they almost want to happen, right? They want to make it so you're re-traumatized, so you won't want to go forward, or you don't have the funds, or you don't have the time and energy to really fight this. And the fact that she even went public with this story, I think probably 99 out of 100 people wouldn't have even gotten as far as she did. But really, it's because she doesn't want this to happen to someone else. And so I think we should really commend her for coming forward. Regardless of what happens with the situation, it's really something we need to talk more about.
100%. Like, I mean, at the very end of the day, like I said at the top of the episode, when you are hurt or you need care, the very least of what you'd expect is if there was something that happened, they did the wrong-sided surgery or they left an instrument in me. The very least is what you want is disclosure, right? That's just the right thing to do, to be like, there was an error here. There was harm here. I am so sorry that this has happened. We're letting you know that this has happened. Again, because that actually, you know what disclosure does? It actually gives the patient power back, because you've taken power away from them by causing harm, by causing damage, by whatever the case may be. And disclosure is the process where you're actually kind of giving power back. And you are not just assigning blame, but you're kind of asking for forgiveness because you messed up, right? And that's why disclosure is such an important part of the medical and healthcare process, because, again, the relationship between patient and provider is supposed to be one of trust. Now, in this situation, how could you feel, and we're hearing these stories, how could you feel that you trust practitioners, or, whether it's a physician or it's a nurse or anybody within the medical field, if they're not going to, take that other oath to make sure that they disclose? I think it's highly problematic. I think right now we're in somewhat of an impasse where there is still fear surrounding conversations related to the patient-provider relationship, and there's still a lot of mistrust. Previous to COVID-19. COVID-19 of course, made the situation 10 times worse. But there's a sense and an air of mistrust of physicians and medical practitioners. And this is well before COVID-19. We could go back to the fact of, historical context where, there were some horrible things that were done to patients and racialized folks and indigenous folks in relation to healthcare. And, there's that mistrust was already built into the system, baked into the cake, as some would say. So again, the fact that, we have this instant where this has happened just very recently, and this woman has no answers, and it's easy because, they could go into the chart. They could see the two names. Here's physician X, physician Y, pull them into a room and have a conversation. It's not going to happen. And I think that's what's
and they're going to say they're like, I don't remember. It looks like everything was done properly. And this really irks me because we talk all the time until we're blue in the face about patient-centered care, person-centered care, patient and family-centered care. Well, it doesn't end when the patient leaves the facility. When they come back with an issue, this is like the complete opposite of patient-centered care. So tell me exactly how this is benefiting the patient other than re-victimizing them, making them feel like somehow they're to blame for this issue. Like, I can only imagine the conversations that didn't make it. Like, maybe they would say to her, "Oh, are you sure you didn't have another procedure where maybe this could have happened?" And I just want to call out the elephant in the room. Anybody listening is probably thinking like, "Oh my God, I've had this procedure, I've had pain since this happened." I don't want people to think that this is always the case, but if you have a gut feeling that something's wrong, I would definitely dig deeper and push back and get answers to your questions. And with that, here's a quick word from our sponsor. Attention hospital employees and retirees in Canada. Picture this. A benefit plan designed for casual and part-time hospital employees and retirees who aren't covered by their hospital's group health plan. Introducing Healthcare Providers Group Insurance Plan, a friendly partner dedicated to your health and well-being.
With affordable plan premiums and an exceptional support team, Healthcare Providers, also known as HCP, is dedicated to helping you every step of the way. Enrolling is easy, and you'll have access to a wide range of health and basic dental benefits from day one.
Already have health and dental coverage through another group plan? HCP still has your back. For less than $32 a month, the Signature Package, which includes life, long-term disability, accidental death, disease, and dismemberment, provides valuable income protection and peace of mind for the unexpected.
So take charge of your healthcare and financial security today. Visit healthcareproviders.ca to learn more. Well, I think the other piece at the end of the day is that our health information actually belongs to us. I don't think a lot of people recognize and understand that when you go to a hospital and you have a procedure or whatever you have done, you can actually, through freedom of information request or through the request of the privacy commission at the hospital, go and ask for your, for all of your documentation. That there's this weird, that information's owned by the hospital. No, it's owned by you as the patient. So if there's something that you want, they can't stop you from getting it. Like this person, she could actually get the whole OR count, right? So technically one of the things that are supposed to happen when you're having surgery, they count all the instruments. For example, really what's weird about this too is an epidural happens before all the other magic happens. So let's say she had a spinal combination, that would have happened right at the top. And I don't think there's anything specific in terms of how they would go about accounting for their equipment. Because if you think about it, that is literally a physician-led procedure. If the nurse is there, they would be maybe opening the medications and holding it so the physician can draw the medications up. But there's no nurse whatsoever. So again, a part of that process is and if you've seen it being done, if you break that needle off, you will know. There is no way you would not know. So again, it's just kind of at the end of the day, whoever this physician was would have signed off that all of their, they put this medication in, they used this gauge needle, they did X, Y, and Z. All of that would have been documented. And the fact if they signed off and said everything was clear and great, That's a problem. But again, that information belongs to you as the individual, as the patient. And at the end of the day, I want anybody who's listening, if you feel that there's some sketchiness happening, you have the right to see everything that is written about you in terms of your documentation, in terms of your health history. That information belongs to you, even though there is this weird sense where it seems like it belongs to the healthcare provider. It seems like it belongs to the physician. No, your health information belongs to you. So if you want to take it and you want to get it, go ahead. It is absolutely yours to have.
Right. And exactly. And there is a process to follow, right? So sometimes you have to go and formally request it, and you may have to say why you're asking for it, although you don't need to get into details. Like, I actually went back and got my birth records, not for any nefarious reason other than I just wanted to see my birth records. And I think you have so many years to go get them, right? So I had gone to the hospital where I was born, asked for the records. They said it would take a while because they had to photocopy things. Like, they can't give you the originals, but they photocopy everything. They give it to you in a folder or whatever. Maybe if it's electronic, they'll have to print it off, but you have every right to get it. And there is nobody that can say to you, you can't have it. Now, some hospitals may not want you to have it for whatever reason that is. And they may come up with excuses like, oh, you wouldn't understand the medical jargon, or, someone really should review this with you. No, they don't have to. You can independently do that. You can find subject matter expert to explain it to you. But if you feel like you're being talked out of something, just know your rights. And like you said, Amy, you have the right to your record for whatever reason it is that you want it for.
Yeah. And I mean, they like, even if they ask you the reason, you'd be like, it's because I want to shit on it and blow it up and have a bonfire. Like, it doesn't really matter what you want for it. Belongs to you. And at the end of the day, it's yours.
And I will add one other thing. Some hospitals, like in my case, they did charge me a nominal fee.
I was just about to say about that.
They charged me a nominal fee. It was like per page, something like, I don't know, like 25 cents per page. Right. So just know that you may have to pay a small fee to get your records, but it is still your right to have it.
Right. I mean, I think that's so shady that you like, I understand that you have to, like, you're paying for the ink, you're paying for the paper that it's printed off, but like, we should get with the times. These things, if we can make sure that we have more secure medical health information systems, that these records can be sent electronically, and that the person, you don't have to pay, 20, like you said, maybe it's 25 cents a page for your medical records. But again, at the end of the day, they belong to you. And it just irks me that there's this weird sense of ownership about who should have it, who should not have it, what should the patient know versus what the patient shouldn't know. Well,
we should know everything. If it's concerning
the patient, they should know everything, right? I think the other piece I wanted to talk about is this whole idea behind like the botched investigations. Again, hospitals just seem, we know this. Hospitals will always, at the end of the day, protect themselves and their image. Like,
exactly,
bar none.
100%.
I'm sorry. I know people out there, they're like, Amy, you're jaded. No, I'm not jaded. It is literally the system. The system is set that hospitals will always, at the end of the day, protect their reputation, protect themselves. They don't want to make those payouts. Like, I mean, at the end of the day, they will if, harm has occurred and, they went through all of this legalese process. And yes, they have to pay the patient. Of course, they'll do that. But at the end of the day, they don't want to.
And above all else, they don't want their reputation ruined. They don't want their name dragged through the mud. 100%. So they will, I firmly believe they will pay to keep their name out of public record if possible.
I completely agree. I think whenever it comes to, like, let's say it's the media or something that's coming and it has their name, they will skirt and do whatever they can to try to get out of the limelight, because hospitals are supposed to be these favorable environments, but they really are not like they really aren't. And it's really sad that, we as two nurses have seen the veil being pulled back in terms of, what really happens behind closed doors when there is harm. And at the end of the day, like, I used to have such a, such a happy mind in terms of quality improvement, being like, all right, yes, we're gonna get in there, we're gonna do all the right things, we're gonna, find out why this happened. And then I started to slowly realize that it's like, okay, we have the process. But is it to just check boxes? Because sometimes you're spinning your wheels in terms of like, okay, this has happened. Here are the steps that we're going to take to make sure it never happens again. But then we had the same incident like a week later or whatever. Anyways, let me hop off of my soapbox. But again, in terms of these botched investigations, it's like, how do you have like the College of Physicians and Surgeons of Ontario investigating their own, like person who works for them? They're like, what are we doing here? Like, does that make sense? It's like,
is that not a conflict of interest? Okay, let's just
come on. It's like, we have police officers, the SIU unit that's going to be looking into the case. Well, they were previously police officers. Like, let's make it make sense. Like, we need to have independent folks actually doing these investigations. I would never trust an own organization or own entity investigating one of their own members.
Themselves,
of course,
right.
I can only imagine what the outcome's going to be. Like, it's just crazy, right?
Okay, so let's take a step back. Let's say somebody listening is genuinely concerned about a procedure that happened, and they're thinking, what the hell? Like, what do I do next? So maybe we can talk about what someone should do if they feel concerned about a procedure they've had, and they're not really sure what to do next.
Yeah, well, the first thing that you do is you're going to contact the hospital. And most likely it's through patient relations or some form of like, it's not like a human rights, but it'd be like through patient relations, through the quality improvement and risk department. Like, that's the first initial step that you would take. And then the step after that is, again, the hospital will investigate. Again, and this is where I say, as like an individual, as someone who's worked in the system and has also been a patient, this is where I'm like, you know what? Yes, you can, email patient relations, but I'm the type of person where I'm like, okay, is there a CEO that works there? Most likely. Yeah. Are there managers and other leaders? Yeah. Are there MPPs or MPs within that region? Yeah. How serious do I want people to take me? Very, very seriously. So everyone will be CC'd on that email until I hear something. Like, that's the kind of, if I know that, from a physician standpoint, they're going to go scorched earth on me, my stance is to go scorched earth on them, because at the end of the day, that's my health. I have to protect myself. So I would say to people that are listening is like, okay, yeah, that is your first step, but make sure that you involve all of the parties that you want to know about it and know about that situation. And then, yeah, the next step would be that the hospital would do their investigative process, whatever the case may be. So, and then from there, typically what would happen is, there's some more communication that would happen between yourself and the risk management department. And, I guess conversations would continue to happen in terms of whether there was harm or not, and then what would happen afterwards.
Yeah, and I'm of the same mindset that you shouldn't just sit back and take people's word for it. So if they say they're going to look into it and it's been a month, you need to kick it up a notch. So if one person tells you they're going to do something and they don't follow through, I mean, this is obviously a really important issue. But if you feel like you're not being taken seriously or you're at the bottom of their list, you need to kick it up a notch, right?
Yeah.
So senior leadership, VP, if you feel that you have a case, I would definitely seek legal representation, because you need someone on your side. And the truth is, we just went over this. The hospital is looking out for themselves.
Yeah.
In a lot of cases, as much as they say they're patient-centered, they're protecting themselves and their own. So if you need to seek outside counsel, if you need to talk to someone else, to understand exactly what happened, definitely do that. If you need to file a formal complaint, there needs to be something in writing. So I guess that's the other thing, right? If you're having these face-to-face conversations or conversations on the phone, you need something in writing.
Yeah.
If they say they're going to do something, ask them or tell them, actually, I'd like you to follow up with an email, because I really need this for my records that you're going to look into it by this date or get back to me by this time. And, it sucks that we have to advocate so hard for ourselves, but this is the world that we live in right now.
Yeah. And I'd also say to remember that the buck doesn't stop with the hospital. So like, if you're not satisfied with what, they've come and said to you, you can go to various media sources. You can go to like CBC, Go Public. There's all sorts of media revenues that you could reach out to. And I think the other piece would be, kick it up a notch to like the Human Rights Tribunal, the patient ombudsman. I think some people think that when the problem happens there, if it's not solved internally, like that's it. You can definitely take it as far as you want to take it. Unfortunately in Canada, we're not as litigious as folks in the States, but maybe we should be. Like, maybe we should be more litigious, because that would actually make people think twice about maybe leaving a needle in someone's back, because someone would have to pay for that if we were in a different type of, situation than we are here. Because again, I don't even know if this lady could take people to court to hold someone criminally responsible at this point, because I would say that this would be considered assault. This person left something in her back, caused her pain and suffering. If this was the States, those two anesthesiologists would be up the creek with no paddle. Someone would be going to prison, and someone would be paying a lot of money for this lady's pain and suffering. And it shouldn't be the way it is here. I think we have a lot of issues within our healthcare system, and in terms of how we find, justice for patients and accountability, there really isn't one. And I think that we should never have those cases where they're so far gone, right? It's so bad that it's like they have to make sure they, pay or, do a huge public show of making all these sweeping changes, when it should be just at the very bare bones of it. If you cause harm, apologize and do something to make it right. Right. That's like how
just be a decent human being, do no
right.
harm.
But
right?
I mean, I guess these hospitals are entities, right? They're like these massive money generating institutions. So some people would be like, our hospitals don't make money. Well, look at your CEO's paychecks and tell me if they don't make money. I think we just need to do something radically different. It's unfortunate that, we have these situations that happen, and this woman's going to walk away with no information, she's not leaving this whole situation any better than what she started, which I think is a huge, massive failure of our public healthcare system.
It is so unfair that a mistake that probably happened in 30 seconds is going to affect this woman for the rest of her life, because she actually had these kids, I believe it was 2002 and 2004. So this has been 20 years already ongoing, and it's going to continue for the rest of her life for some mistake that someone made carelessly over 30 seconds. And truthfully probably doesn't even remember it. But, that, I feel like the magnitude of this just needs to be emphasized. It's not just like, oh, someone broke a bone and they're going to be better. No, this is going to affect her for the rest of her life.
Yeah. And I mean, I don't mean to continue to bring another downer into this, but there was another case that I wanted to talk about of a young mom who died of an infection a week after giving birth to her third child. An epidural catheter, again, was left in her. She was 25 years old, and it was left in her back for 28 hours, and she actually died. So, I mean, at the end of the day, this woman is lucky to have her life, but there are cases that people don't make it, and they go home, and these things happen, and they do die. And I think this is where we should never be waiting or, seeing an instance where someone has to die for someone to do something, like hospital systems do something drastically different, because once you lose someone, you can't get them back. Right. That's mm-hmm. it. And it's just, it pains me to say that our hospital systems aren't necessarily looking out in the best interest of the general public. Again, I'm not saying that, hospitals are these evil places. There's a lot of great people who work in hospitals. There's a lot of good things and initiatives that come out of hospitals. But again, it hurts that when it comes to that, that bottom line where it's like, who are you going to save, yourself or this other individual? That hospitals will first protect themselves, then look in terms of, supporting the patients and families. And again, I have seen in some cases where hospitals have done the right thing, but sometimes their arm's been twisted to make sure that they have, which is, you shouldn't have to twist someone's arm to make sure that they do the right thing when there's harm.
Right. So I guess just in ending and wrapping up this episode, if you are concerned about your health, always make sure to get a second opinion, ask questions, keep pushing until you get the answers you need. That goes for your loved ones. If they're in a vulnerable situation, like elderly, or maybe they don't speak English, make sure that you are there to advocate on their behalf. And always, if you feel the need, bring it to the media, bring this to light. This is exactly what we need to do. And I think that this person is really brave for doing what she did. And I hope that we continue to have these conversations. So thank you so much for listening to this episode of the Greedy Nurse Podcast. And we will be back again with more stories.
Absolutely. And if you're ever looking to submit a story, like I mentioned, you can always email CBC at gopublic@cbc.ca. There's other institutions and other media avenues that you could reach out to. Like Sarah said, lawyer up if you can. And again, you are the most important person. So again, your records belong to you. Your health belongs to you, and you should make sure that you should do everything in your interest to make sure you protect yourself. So thank you again for listening, and tune into our next week's episode of the Green Nurse Podcast. Thanks so much, everyone.
Thanks.